The USF College of Public Health was the first college of public health in Florida. It was created by the legislature with a very distinct mission: to prepare professionals for the public health workforce in Florida and around the world, but also to be a resource to that system, to that workforce, to the elected officials and the policymakers who are charged with the responsibility of protecting the public's health, and a resource to communities who seek to create conditions in which everyone in those communities can be healthy. This college has been here since 1984. We have recruited an outstanding group of faculty and senior staff, and of course a terrific group of students. And those people come together and seek opportunities to do what's best for the citizens of Florida, to model interventions that can be carried across the country and across the globe, and to build systems and partnerships and infrastructure that are then able to be used for other purposes as new opportunities come along. So I'm really very proud of what we've done here at the USF College of Public Health to create those kind of structures that enable families to seek and find health insurance coverage for their children, to gain access to high-quality health care. The work we've done to create clinical interventions that are effective, and the work we do at the population and community level to create healthy communities in which families can thrive. So today's announcement just extends that work. I think it recognizes the good work we've done and the great capacity we have to do important work to help the nation meet its objectives. And with that, it's my distinct pleasure to introduce the Honorable Kathleen Sebelius, the Secretary of the U.S. Department of Health and Human Services.
Thank you.
Secretary Sebelius.
Thank you to Dean Peterson and to President Genschaft for having us here at the University of South Florida. I was here about a year ago doing an event on the downtown campus, and I'm really pleased to have a chance to be back at this great institution. I want to recognize a real health leader in the United States Congress who happens to represent this district, Congresswoman Kathy Castor, who is with us today, who not only is here because of her passion and interest in making sure Florida families are healthy and have the opportunity to live full and productive lives, but has a great connection to this university. Her mother, my friend Betty Castor, is the former president of this university, and we're in the auditorium named for her stepfather, so I'm sure you feel like you're right at home. Yes, indeed. But I appreciate the great work that Congresswoman Castor does. And I also just want to recognize that although he's not here today with us, Senator Bill Nelson has been an enormously important champion. Bill and I served together as insurance commissioners years ago, and I have known and worked with him since those days on a whole variety of health issues, and he does a great job looking out for Florida citizens. With me, and you'll hear from her in a little bit, is Jody Ray with the Florida Covering Kids and Families Project, and we're going to be able to announce some exciting news about them. It's great for me to be back in Florida. I'm in and out of this state a lot, and I am thrilled to be here with leaders in the academic community, in the neighborhoods, in outreach groups, and in elected office who are interested and invested in the health and well-being of the community where they live and work. Now, we're less than 50 days away from connecting millions of Americans who don't have insurance or who buy their own coverage and are looking for a better deal with quality, affordable health coverage, some for the first time ever in their lives. On October 1st, every state, including Florida, will have an online insurance marketplace where customers can find a plan that fits their budget and their needs. Open enrollment starts on October 1st for coverage in a plan year that starts as soon as January 2014. And we've made a couple of steps to get consumers started. We've relaunched a website, healthcare.gov, and the Spanish version, cuidadodesalud.gov, to provide information and updates about what is going to happen in less than 50 days. Right now, if people go to either site, healthcare.gov or cuidadodesalud.gov, they can establish a personal account to begin the process and receive information. For many people, enrolling will be a quick process they can complete on their own. For others who may want more assistance, we have other great resources available. Healthcare.gov has a live web chat feature, like you see when you're shopping online. And for those who prefer to actually talk to a live human being on the phone over a computer, we have a 24/7 call center with a toll-free number with people ready to answer questions in up to 150 languages. But we also know there are people who prefer in-person assistance to ask questions and make sure they get all the right information to help find a plan that fits their budget and need. And that's why today I'm really pleased to announce another critical step in that help for consumers. Our department is announcing $67 million in 105 Navigator Grant Awards to support organizations and individuals to provide in-person assistance in the federally facilitated and state partnership marketplaces across the country, including here in Florida. Now, here at University of South Florida, that means that the Institute of Higher Learning will help local individuals and families apply for coverage, answer questions about coverage options, and help them make the best possible informed decision about which option may be best for them. In Clearwater, the Pinellas Board of County Commissioners also received a Navigator grant. In total, across this state, there are 8 organizations who will work statewide and receive more than $7.8 million in Navigator grants to make sure that people receive the help they need to sign up and enroll in coverage. Now, before anyone can help marketplace consumers, navigators will be required to complete at least 20 hours of training, be certified that they have completed that training, and additional training throughout the year. They'll need to renew their certification yearly and must pass a test before being certified. They are going to be required to adhere to strict data security and privacy standards, including how to safeguard consumers' personal information. Now, all of those steps help protect consumers and encourage them to ask questions, verify answers, get all the information they need about what's right for themselves and their families. We know there's a lot of work to do in the next couple of months, but we'll be ready for whatever comes up. We're in the process of testing and retesting our data systems. We're monitoring feedback and making changes. We're responding as we go along. And we're right on schedule to provide consumers with tools online, on the phone, and in person to get the coverage they want and need. We'll be ready on October 1st. And with that, I'm really pleased to introduce Jody Ray. Jody?
Thank you, Secretary. Hopefully I'm speaking loud enough. I just want to say thank you, obviously, to Congresswoman Castor, because she had provided us ongoing support for the work that we've done to reach out to the uninsured in the state of Florida, as well as Dean Peterson for supporting the work that we're doing here at the university and at the college, and obviously to the Secretary for allowing us to expand the work that we've done to reach out to the uninsured and get them enrolled into coverage options that they will soon be available for. We're very excited about the fact that USF is going to be a statewide resource for this information. We will have the expertise needed to assist families, and we will be reaching out and working with communities all over the state, actually, and they are designed to be reflective and unique to the communities that they'll be serving. They're very diverse. The state of Florida is obviously very diverse geographically and demographically, and the work that we're going to do is going to be designed around being able to reach those families in the way that best suits them and those individuals that will be eligible for coverage coming October, to enroll coming October 1st. So those efforts are going to be going on all over the state, and we're very excited that we can expand the work that we have been doing, and we really look forward to working with all of these communities to be able to communicate to families about the exchange and the marketplace and what they will be able to get coverage in. So the plan is to work with organizations in each of the regions around the state that are trusted and credible sources in their communities. They know who the individuals are, they know where to find them, and we will work in concert with them collaboratively to find the eligible uninsured and get that information out to them very aggressively, very actively, and be able to provide them with the level of expertise needed to complete the enrollment process and be able to make decisions about what they want to do for coverage. So that's our plan moving forward.
Well, with that, I'd be happy to answer some questions if you've got questions for me. Yes.
Secretary, in this short time frame, we all know insurance is a very complicated issue if you've ever tried to wade through one of your company plans. And this law is very intricate. How confident are you in this short time frame that these navigators will really be versed and be able to help people?
Well, I think there are a couple things about the navigators. One is that they will go through some intense training before they can actually talk to a consumer. When I ran for insurance commissioner in the mid-90s in Kansas, I decided I should take the courses and the testing for an agent's license, so I would be more familiar with what that was about. And in most states, as was the case in Kansas, it was about 20 hours of coursework and then a test. But that coursework covered the waterfront, from life insurance to car insurance to health insurance to annuities. And that's what you needed to do to be certified as an agent or broker. Brokers had additional training, but as an agent, at least in our state. So these individuals are specifically going to learn about one law, about the options of that law, and they're not going to be paid by a company or by a consumer to sell any product. They're really there to answer questions, give information, help people make comparisons, answer issues about what a deductible is, what a copay is, and they will have resources behind them at our call center, on site, in our regional offices to deal with complicated situations that we can't help. You know, we run the senior health insurance counseling program right now around the country, where volunteers are trained and work daily with Medicare beneficiaries on complicated billing issues, health issues, qualification issues. So we're knowledgeable about what a great job people can do with some training and with the interest of really helping beneficiaries. So I think this is a great opportunity. And I know that organizations like Jody's, now there may not be anyone as good as you, but what we look for in these Navigator grants, the 105 organizations who receive grant funding around the United States, is people who already had networks in place, who knew how to do outreach, who had connections in the community, and as Jody said, they here in Florida have been working on children's health insurance, making sure that parents understand what the qualifications are and how to do outreach. So these aren't folks who don't have experience and background, connections, and information already.
Just a point of clarification, wasn't it originally like 54 million and now it's 67? Did that go up?
It did. We were able to provide about $13 million of additional resources out of the prevention funding because some of the other projects did not cost as much as we thought they would, so we were able to shift additional dollars over, which is good news because I think these are individuals who will really be connecting people to coverage and having that ability in a culturally competent, language competent manner to do outreach to many people who really haven't ever had coverage before and answer questions and get folks information so they can in turn make good decisions for themselves and their families is really an important piece of this puzzle.
What kind of timeline are you expecting for these grantees to work on? Do you want them to hire, train, and be ready and already out on the streets or on the phones come October 1st?
You
What
bet.
is your expectation, and how's that gonna actually happen in just a few weeks if you're talking about background checks and training?
Well, there isn't a background check requirement that we will impose on the individual. Organizations will be screening the people who, so our grants are to organizations, to valid community organizations who have networks already in place. And we have an agreement with them that no one will be certified until they actually complete the training and are certified completing, and we'll be keeping that information in a database. We will know when an individual actually completes the training
And takes a test?
and takes the test and is a certified, and each of those individuals will have a number associated with their completion of the exam, so that people can ask for the information and verify the fact that this is actually a trained and certified navigator. But as I said earlier, part of the grant application really looked for organizations that already had networks in place. So will there be people who need to go through additional training? You bet, on this specific law. But we're not talking about people who are starting with no network, with no outreach person, with no ability to do this. I was telling Jody earlier that this was a very competitive application process. We had lots more people apply than we could fund, and we really looked for already established groups who were ready to hit the ground running, knowing that this would be a fast turnaround time.
Have you prepared the training itself?
Yes.
So that's ready to go?
Yes.
If someone's
Yes.
ready to take the training
And people
tomorrow?
are already, some of the certified application counselors, which are volunteers in organizations, are already starting to be trained. We have agents and brokers training that's online. We've been training individuals in elected officials' offices who want to be able, so there are various levels of training. This will be the most complete package of training. It's a full 20 hours. They will take the test, they will get certified, but those training materials are ready to go.
You say 20 hours, but like how long is that spread out over? Is it like 4 or 5 hour days or?
It's an online course with testing along the way and then a final certification test. So if somebody wanted to do it, it really depends on the individual and their time and efforts. But it is a full 20 hours with updates required and regular certification.
And just a point of clarification, USF, Jody, are you guys kind of spearheading this and kind of working to lead the collaboration statewide, or how is that working?
We submitted a proposal to cover most of the state, yes. So we'll be covering all counties except for Monroe, Miami, and Broward. So that covers about 66% of the uninsured in the state of Florida.
But there are a total of, I think it's seven organizations throughout the state who have gotten grants for either a portion of the state and maybe a specific population. So it won't just be the USF network. There'll be additional folks in Florida.
Is that 7.8 million spread equally through these 8 organizations? Or?
No. Depending on the size of the organization, the amount of territory they were going to cover, what their coverage options are, their